Getting ready for a rollout, Government today agreed a key part of Ireland's COVID-19 vaccination strategy. Who will get the jabs first when one becomes available? The plan sets out each group according to how vulnerable they are to the effects of COVID-19 and is contingent on many factors as we continue to learn more about the vaccines themselves. Adults aged over 65 who are residents of long-term care and who are at the greatest risk will be prioritised first, along with frontline healthcare workers who are in direct contact with patients, as they are also considered to be high risk. Older people at higher risk of hospitalisation and death will also be prioritised, beginning with those aged 85 or older down to the age of 70. Other priority groups will also include key workers who provide essential services, people between 18 and 64 who are residents of long-term care and who are considered to be at high risk of transmission, as well as people in the same age group but who are living or working in crowded accommodation where self-isolation and social distancing is difficult. Those who are essential to education and keeping schools open would also be in line, along with those aged between 55 and 64 who are at the risk of hospitalisation. And finally, people aged between 18 and 54 who do not get vaccinated in earlier phases of the rollout.
I think the prioritising groups are sensible. The residents in long-term care would be the high priority in my view, because if you look at the numbers that have died from COVID-19, over 90% of these are over 65 and a significant number of those are in a residence in nursing homes.
Ireland has already secured more than 8 million doses of 6 different vaccines. The Pfizer-BioNTech vaccine is expected to be the first to be approved here by the end of the year, but we still don't know how many doses we will get in the first deliveries.
The exact amounts and volumes for every member state still have to be agreed with the various pharmaceutical companies as to when they arrived. So certainly we will not be beyond COVID in January. It's going to take time for every country to roll these out to the priority groups and then to everybody else.
The COVID-19 vaccines will be free of charge to everyone. Laura Hogan, RTE News.